Hello, Sherry. Welcome. First one here. Thank you all for coming. Hey, Jem. Hey, Jolie. Good to see all of you. Angela, I know there's a lot of people coming in now, so great to see you all. Hey, Mustafa. Hey, TJ. Hey, Wendell. Great to see you. Thanks for coming, Allison. Great to see you. And let's see, Julie. Good to see you. Oh, Julie. Great to. I hope you're doing well. Please chat. Just see. Tell me. Tell everyone chat and just say where you are right now. Are you at the beach like Jen? Jen's at Bethany Beach right now. Some people are in Oregon. Are you in New Jersey? Are you in Maryland, DC, Virginia? You can let's do a little chat today just to kind of see where people are. Hey, Tanya. Good to see you too. I know we have someone on the phone, so good to see you as well. Let's see, Maryland. Yep, I'm in Maryland. I'm at the office here wearing my scrubs. I think Dr. Keats is here with us. Dr. Keats is naturopathic doctor and integrative naturopathic oncologist, has a degree from a naturopathic medical school as well as a fellow of the American Board of Naturopathic Oncologists. And she's here today to talk to us about cancer prevention, which is a hugely important topic. And we know that cancer is actually immune system dysregulation. And so I think even there's a connection between immune system dysregulation and COVID and immune system dysregulation and risk of cancer. So I'd love to hear your comments on that, Dr. Keats.
Sure.
I'm going to start here, if I can click it. Community updates here. So here's the potentially the COVID diet with the asterisk. This is not something that CIH officially recommends at all, but there are people with kids, there are people with different things. People are at home more, and this is just a joke. This is not an actual recommended COVID diet, but a lot of people are on a diet and exercise plan, kind of like this dog here, with this kind of in this easy chair watching some Netflix. This is the COVID-19 exercise program. So, I just wanted to take a breather here and I don't know if anyone's want to do this, but just give ourselves some space and compassion right now. So, if whether you're at home or working or wherever you are, if you're have family around, if you're living by yourself, let's give ourselves some space and compassion right now, because this is a difficult time. And, let's not judge ourselves, not judging others in terms of kind of what's right or wrong in terms of these lifestyle things. Everyone's trying their best. So please, if you want to just put your hands on your heart and just take a deep breath in and out, and just giving yourself some space and compassion right now during this time. Sending good intentions, forgiveness, compassion, understanding to yourself, to those around you, whether or not they're wearing masks or not, to your family, your friends, coworkers, everyone. So we can get through this together. Just taking a couple more deep breaths here, in and out. So I just wanted to show you this for a little bit of change of pace here on this wellness webinar. This is our bunny at home. She's a lion head bunny named Dandelion. She looks kind of like a cross between a cat and a dog, has some lion features here with the whiskers. She does like sunflower seeds and enjoys treats like dried fruit and things like that, and loves to be petted. So that's just a funny picture. And then I think for immune system health, we really talk about how we want to get outside to prevent cancer too, right? Because we know that indoors, there's a lot of chemicals. We know that indoor air is 4 times as polluted as outdoors. So even if we want to wear a mask, be social distancing, that I agree with that. But my favorite spot in the entire house is outside the house on the deck, because it helps calm my mind, collect my thoughts, get some fresh air, hear the birds, and kind of detox my body, and my mind and spirit. So just some things to talk about. Coronavirus, the cases are starting to go back up in Maryland. I just checked that yesterday night. Little concerned about, are we opening too soon? I think we definitely want to still have 6 feet social distancing, mask. We don't know how the virus spreads. Is it just contact or droplet, or is it airborne as well? How long do antibodies last for? That calls into question whether or not vaccines are going to be effective. I'm going to talk about that a little bit later. Potentially as little as 2 to 3 months based on blood tests right now, but from the United Kingdom. And we don't know if there's long-term effects of COVID-19 like there would be for Lyme or something like that, or Epstein-Barr, that could even be long-term effects of coronavirus. And I've seen that even with a few patients here. And we don't know what's going to happen in the fall, so I'd love to hear your thoughts on that. With the concurrent flu season, what are we going to do for that? And research is ongoing on all these things. The cause of death in COVID-19 is basically inflammation. It's immune system dysfunction, inflammation, not necessarily the virus itself. It's the body's response to the virus having a over-inflammatory, or what's called an acute systemic inflammatory response as a reason why people actually die from it. So reducing inflammation, which I think we're going to talk about today also with Dr. Keats, is a big thing with both preventing cancer and also preventing and also treating COVID-19. There is this company in Cambridge, Massachusetts called Moderna, and they're partnering with the US NIAID, which is the Allergy Infectious Disease Department, on a vaccine. And then they just completed phase 1, which is 45 people. They're going to do phase 3, 30,000 plus people in late July. So they're speeding through this. I do think we have to look at safety and efficacy, but they are trying to find a cure for coronavirus at least. So that's, I do applaud their effort for that. There are some considerations we have to think about for the immune system, which I looked at last week. So I'm going to just kind of put this up here and you can listen to the recording later. But lifestyle is huge, using that smart lifestyle of sleep, mindset, activity, real food, and ties, which are relationships, using powerful mind-body techniques such as acupuncture, myofascial release, and also balancing your blood sugar and balancing your vitamin D levels, boosting your immune cells are going to be huge. IV vitamin C is huge, IV zinc, and potentially phosphatidylcholine to help the lung membranes. So there's a lot of things on here, and I think I do want to do a disclaimer just to make sure we're not overstepping our bounds, that these things are not proven. There's no FDA-approved treatment. Supplements are also not, proven, and so, we want to discuss that with your practitioner. And some other just things to kind of review is that, Dr. Keats is an amazing person and a friend and a physical therapist that is partnering with us, part of Can Be a Physio, and he's seeing CIH patients on Monday, Tuesday, Wednesday, and also Fridays in person. The Fridays is the in-person day. The functional movement is so important for staying well, to activate the body's healing potential, and keeping active and in motion is something we could all do more of, I think, right now. Certainly don't want to be like that dog watching Netflix there. Dana Keys is amazing. Just had a treatment with her recently too, and she's a energy practitioner. She does Reiki, and she did a town hall. When we called it town halls more a couple of weeks ago, so we'll have her on again. And she's here at CH in person Monday and Thursday, again to activate the body's own innate healing potential, because we know even in terms of cancer, and I've seen this a lot with people I see here too, is that sometimes the stress that affects the energy membrane that surrounds us, that's not something we can see visibly, but it's something that's been shown in research from electromagnetic research, that the body's electromagnetic field extends about 6 to 8 feet out from us. And so that can actually be affected by stress. And so we can use energy treatments to uplift the body, mind, and spirit. And Elizabeth Reese also is amazing. She's a founder of Interflourish, and she is at CIH as a heart math practitioner, and she's here Monday, Tuesday, Thursday on Zoom. Heart math being a type of biofeedback that entrains the connection between the mind, brain, and heart. And if there's anyone that has autonomic nervous system imbalances, which I think we all do at times now with these chronic stressors going on, COVID and racial injustice, and just a lot of transformation right now happening in our country, we want to actually make sure our autonomic nervous system is balanced. And one of the best ways to do that is heart math. So please, if you would like to talk with her, you can schedule that with one of our wellness coordinators here. And then Katie and I are also doing a second gut class on irritable bowel syndrome and optimizing gut health. And you can email Wendell, who's on the call today, on the CHARM system to express interest in the gut class. Good to see you, Wendell. That's going to be Tuesday, July 28th from 4 p.m. to 5:30 on Zoom. That will be billed to insurance, as are the other things that we're just talking about today. So back to the polling question. So should we open schools in the fall is the first question here. I'm a little concerned about that. I have 2 kids myself. I'm curious what people think about that. Are we opening things too soon? I know Montgomery County is trying to do this hybrid approach right now. I think private schools can kind of do what they want to do as well. I've heard from some people that they're doing a lot of online stuff. But, you know, should we open public schools in the fall, I think is another, or just schools in general, just what your feelings are on that. And, you know, as we kind of move through this together, we're going to have to really figure this out together. And I think having some sense of, you know, people's opinions, I think, you know, our voices do matter, and we have to be vocal about this. Okay, so online first, and so the maybe one, so I think we're not totally sure yet. Some people said more online, and 2 people said yes for sure. Definitely a lot of you know, pluses, pros and cons either way. We can talk more about that. So Dr. Keats is on today. Here's the schedule for July, and we're so happy to have Dr. Keats here today to talk about cancer prevention. Thank you so much for coming on today, and I will stop my video and hand that over to Dr. Keats.
Okay, sounds good. So good afternoon, everyone. Thank you for attending. Happy to see all of you here. I'm just going to go ahead and share my screen so that we can go ahead and get started. Okay, great. So obviously I'm going to be speaking about cancer prevention today. And before I get into that, I just want to introduce myself, because I don't know if I've met everyone that's here on this call. So my name is Dr. Aminah Keats. I'm a board certified and licensed naturopathic doctor, and also a fellow of the American Board of Naturopathic Oncology. And so I do specialize in integrative oncology care, and working with patients who have a current diagnosis of cancer or a history of cancer, and really focusing on side effect management and reduction as it relates to chemotherapy, hormonal therapy, and targeted treatments. Also working to improve quality of life and to improve survival outcomes. And also, most importantly, to prevent the risk of cancer recurrence or cancer coming back. Now, before we get started, I have a couple of polling questions that I'd like to put up. The first is, I'd like to know, do you have any concerns with a current diagnosis of cancer or a previous diagnosis of cancer? That will be helpful to know as we move through the slides. Okay, so it looks like there are some concerns with the current or previous, but maybe most of you are more interested in prevention, which is fine, because what we're going to be speaking about today addresses each of those categories. Okay, one more polling question before we jump in. Oh, sorry about that. Okay, do you currently have a cancer prevention plan in place? If you could answer that last polling question, that would be great. Okay, so it looks like some of us do and some of us don't. So, okay, so let's jump in, because the suggestions that I make today are things that can be simply implemented into our lives, and actually implemented into our lives pretty quickly and easily. Okay, so as I stated, I specialize in integrative or naturopathic oncology care. And what that means is that I use naturopathic oncology. I work with patients to implement naturopathic oncology into their current plan of care, whether that's working with an active cancer diagnosis or working to create a cancer prevention plan. Naturopathic doctors like myself who specialize in oncology care are board certified by the American Board of Naturopathic Oncology. There's probably only maybe like 300 to 400 of us in the whole country, so not very many. We provide evidence-based medicine when it comes to cancer prevention and cancer inhibiting kind of support. So following the research very closely to determine what nutrients, which supplements, with which lifestyle factors are going to be most appropriate for the specific cancer that's before us, or when it comes to cancer prevention. And then most importantly, or more importantly, working to achieve the best possible outcomes for patients by combining naturopathic medicine or natural therapies with conventional medicine, especially as it relates to active cancer care. Okay, now the specific goals of naturopathic oncology, there's a really wonderful opportunity for natural medicine to work to prevent cancer. In the conventional world, there are more options in terms of killing active cancer cells or active cancer activity, but in the natural medicine world, there's opportunity for cancer inhibiting effects, but also a great opportunity for cancer prevention. And of course, that is what I will highlight today. Also important is cancer inhibiting support. So implementing therapies that help to slow the progression or the proliferation of cancer cells. We want to improve treatment outcomes, especially as patients are receiving active cancer treatment. We want to reduce the risk of cancer recurrence or cancer coming back. So when a patient reaches a space of remission, we want to do everything that we can to prevent that cancer from returning. And there's a lot that we can do for that. Immune modulation. So modulation meaning helping to balance immune function. So in some circumstances, as you can imagine, with a current cancer diagnosis or even without, some people do present with immunosuppression. So under those circumstances, helping to stimulate immune function or to support immune function. And then there are some circumstances where the immune system is hyperactive and helping to kind of calm that process down. Side effect reduction is going to be important, especially when it comes to conventional therapies. There's a lot that we can do when it comes to reducing side effects like nausea or fatigue or sleep disturbance. A lot of things that we can do. We want to improve quality of life. So outside of these kind of common side effects that we see with conventional treatments, we want to make sure that patients are as comfortable as possible. So that means if there is trouble with sleep quality, trouble with falling asleep or staying asleep, if stress levels are very high, if fatigue levels are increasing, we can certainly address those things as well. And we want to provide education for a healthy lifestyle, because maintaining a healthy lifestyle is key when it comes to cancer prevention. So today's points, I'm going to review 3 major points today. One, we're going to talk a little bit about the terrain, what that is and what that means. We're going to talk about the factors that influence the terrain. And then we're also going to talk about nutrients, lifestyle habits, and supplements that support a healthy terrain. So some of you may have heard of when we talk about cancer or health in general, it being referred to as the terrain or the microenvironment. And this is a really different and interesting way to look at cancer prevention and even active cancer. So the terrain is our internal microenvironment. And when I say microenvironment, I'm referring to that intracellular space and extracellular space. So for example, if we think about our cells in terms of the smallest component of our cells at the cellular level. So intracellular meaning the cytoplasm that surrounds the nucleus within an individual cell. When we're talking about the extracellular space, we're talking about that environment that actually surrounds the cells. And so that could be blood vessels, that could be immune cells, and even extending beyond that, thinking about things like our organs. So we want to make sure that that terrain or that microenvironment or that soil is as healthy as possible, so that we don't encourage the growth or the progression of cancer cells. So the terrain can influence our state of health. It can also influence disease prevention. The terrain can be impacted by a number of different lifestyles. This can include things like cigarette smoking or alcohol intake or the foods that we put into our bodies, sedentary lifestyles, environmental toxins, all these things play a role in that terrain or that soil that our cells kind of swim in, if you think of it that way. Now, the goal when it comes to cancer prevention is to make that soil or that terrain as inhospitable to cancer cell growth as possible. And there are many ways that we can do that in the naturopathic oncology world. So when it comes to these factors in terms of how we can influence that soil or that microenvironment, I'm going to review 3 categories. There are many, but I'm going to review 3 today just because of the limited amount of time that we have today. So I would say these are the most important, and certainly the 3 that I focus on when I'm working with most of the patients that I see. So one is inflammation. We know that inflammation plays a huge role, not only when it comes to cancer, but really pretty much any chronic condition. So keeping inflammation levels low is going to be important. Now, when it comes to that acute state of inflammation, it's normal, it's fine, it's a part of the normal, the way that our immune system normally functions. White blood cells come into play, that immune process is quelched, and we just kind of move forward from there. Inflammation becomes more of a problem when the inflammatory levels are high for extended periods of time. Another thing that we're going to talk about today is hormonal influence. So what kind of hormones need to be regulated in terms of reducing our risk of cancer and also preventing the proliferation of cancer? And then toxic overload, meaning what kind of environmental chemicals are we coming into contact with, and what can we do to support our bodies in terms of eliminating those kind of toxins or those xenobiotics. Okay, so inflammation, that is cancer's primary precursor. So that is really the first thing that I address. There's actually inflammatory markers that can be measured in the blood to determine to what degree one needs anti-inflammatory support. So in the microenvironment, chronic inflammation contributes to many things. So one, definitely encourages the proliferation and the progression of cancer cells, definitely encourages a process referred to as angiogenesis, which allows cancer cells and tumors to grow blood vessels so that that tumor can be fed oxygen and different nutrients, basically encouraging growth and survival. Inflammation can encourage metastatic spread. And then also when inflammation levels are high, it can actually cause the body to resist certain therapies like chemotherapy and hormonal therapies and other medications. Inflammation also enhances the production of free radicals that can cause damage to DNA. And so that is really the first step when it comes to carcinogenesis, is that damage to the DNA and the possibility of it going down a more carcinogenic route. So reducing inflammation helps to prevent that process from happening. So the question is, what can we do to reduce inflammation, right? So the first layer for me in my practice is always food. Food is definitely the foundation. And there are so many opportunities when it comes to food in terms of using food as medicine. And so when it comes to reducing inflammation, there are some key players. One is NF-kappa beta. So NF-kappa beta is referred to as a transcription factor, and it is a primary player when it comes to cancer development and even the inflammatory process. It's actually associated with other chronic conditions that are associated with inflammation. Another key player when it comes to inflammation is COX-2, which is an enzyme that promotes prostaglandins, or these inflammatory chemicals. There's CRP, or C-reactive protein, and there's also tumor necrosis factor. So I wanted to list these here in terms of specific targets for these specific inflammatory targets that these foods are able to inhibit. So the first category that I want to highlight is omega-3 fatty acids. So when it comes to our foods, we know that wild-caught salmon is certainly a good source of omega-3 fatty acids, but also things like mackerel and herring and sardines and anchovies. But when it comes to the plant-based kind of sources of omega-3s, those would be things like walnuts, flax seeds, chia seeds. Very important when it comes to reducing inflammation. Then there's quercetin. So the richest source of quercetin in the nutrition world, or at least one of the richest sources, would be capers. There's also apples, onions, bilberries, black currants, black elderberry. And there's actually cell studies and animal studies suggesting that when you take green tea and quercetin together, that there's a synergistic kind of effect when it comes to inhibiting the growth of prostate cancer cells. So just a little tip there. Now, culinary herbs provide a great opportunity when it comes to introducing or adding additional anti-inflammatory effects to our diet and even antioxidant effects. And so the ones that I would highlight would definitely be turmeric. Everybody knows and probably loves turmeric. It's so popular and so well researched these days. My other favorite would be ginger, and then fennel. Now, I feel like fennel is one of the more neglected culinary herbs, but it is a very strong anti-inflammatory and also beneficial when it comes to digestive health. So some other spices that I have there, as you can see, would be coriander, cumin, cardamom, black pepper. The cruciferous family of vegetables is going to be important for so many different things, but certainly when it comes to reducing inflammation. So the cruciferous family, mainly things like broccoli and Brussels sprouts and kale and collards. Radishes are on that list, wasabi is on that list, watercress is on that list. So a lot of different options when it comes to this family. Now, the constituent, there are many constituents in this family that have been studied and shown to have some cancer inhibiting kind of effects. Sulforaphane is one of them, and this is the one that I'm actually going to highlight out of that family. Sulforaphane helps when it comes to liver detoxification. So when we mention the soil and the importance of elimination of these toxins, sulforaphane is something that I think of. The cruciferous family is something that I think of. Sulforaphane is also a natural anti-inflammatory. Now, out of that cruciferous family, your broccoli and your broccoli sprouts are going to have the highest level of that particular constituent. So broccoli is pretty simple. You steam broccoli, you have it, chopped up in a salad, etc. When it comes to sprouts, you can add them to salads, you can add them to smoothies, you can add them to scrambled eggs, kind of whatever kind of works well for you. And then green tea. Now, when it comes to green tea, there's the main constituent in that plant is EGCG. And so EGCG has been studied for so many different things. It can help when it comes to cholesterol regulation. It can help when it comes to enhancing insulin sensitivity. Also important when it comes to immune modulation, but it also acts as a natural anti-inflammatory as well. Now, not all green tea is created equally. And so that means that EGCG, those levels differ from one type of green tea to the next. And so the levels that are highest would be in your organic Japanese sencha tea or your organic Japanese matcha tea. So those are the two that I highly recommend. So I just wanted to highlight turmeric. So turmeric is definitely one of the best and most popularly used herbs when it comes to cancer prevention and even active cancer care. So turmeric is a great anti-inflammatory agent, especially when it comes to inhibiting that NF-kappa beta that I mentioned, which is a key player when it comes to the initiation and the progression of the cancer process. Turmeric has many different constituents, just like all plants do. The one that we're most familiar with is curcumin, right? We've all seen curcumin in supplement form, but there are other constituents like BDM and DMO, which have cancer inhibiting effects as well and anti-inflammatory effects as well, but curcumin definitely being the most studied. Now, when it comes to turmeric, it's really amazing because it affects so many different cellular pathways, and these cellular pathways can lead to reduction or inhibition of apoptosis, for example, which is programmed cell death of cancer cells. It can act to inhibit metastatic spread. It can act to inhibit angiogenesis, the process that I mentioned where tumors are able to grow blood vessels so that they can survive and flourish. And curcumin or turmeric helps to inhibit that process from happening. When it comes to turmeric, there are a lot of different ways that we're able to implement those into our diet. We can certainly purchase the root and boil that and make a tea out of it. You can throw the root in a smoothie, always beneficial to add black pepper and a healthy fat to that in terms of helping with the absorption of turmeric. You can certainly add the spice to your proteins or your vegetables or your grains as well. Okay, another anti-inflammatory kind of constituent or family would be your anthocyanins. Now, we mainly find our anthocyanins in berries. So organic blueberries, blackberries, raspberries, and organic strawberries. The thing that I really like about this family, outside of being a natural anti-inflammatory, is that the berries also have a low glycemic index, so low sugar content compared to other fruits like pineapple or mangoes or bananas or grapes. So this family also helps to inhibit that important transcription factor, NF-kappa beta. And you find those anthocyanins primarily in the skins of the berries. It's part of what gives it that rich color. The anthocyanins also act as a potent antioxidant, so they're able to bind to reactive oxygen species, which prevents damage to DNA. So like I mentioned, that damage to DNA can potentially act as the initiation of the whole carcinogenic process. So antioxidant support is very important. And by the way, I didn't mention, but turmeric is a great antioxidant as well. Okay, this is the best slide ever because this slide is basically saying that dark chocolate is also a great anti-inflammatory. So real dark chocolate, 70 to 100% dark cocoa is going to be advised, but this is a small study I found showing that dark chocolate, this was a human study, showing that dark chocolate helps to inhibit that important factor, that NF-kappa beta. The serving was 45 grams, which I think is about 1.5 ounces roughly. So not a whole lot. So yes, helping to reduce that important inflammatory marker, also acting as an antioxidant. Now, I didn't mention before, but that NF-kappa beta, it plays a significant role with different cancer types, but especially when we're talking about prevention of hematological cancers like leukemias and lymphomas, myelomas, and then also solid tumors like things like lung cancer, breast cancer, melanomas. Okay, now, so since we're talking about food, I wanted to highlight this study. Now, this looked at prolonged nightly fasting, and as I review this with you, you'll see that it sounds, and it really basically is intermittent fasting. So most of us associate intermittent fasting with weight loss, and it can certainly be effective for that, but can also be used therapeutically. So this was a study that investigated whether duration of nightly fasting predicted recurrence or the return of breast cancer and also mortality in women with early stage breast cancer. So pretty large amount of people in this study, over 2,400, ranging in ages from 27 to 70. And they found that fasting overnight for less than 13 hours was associated with a 36% increase in the risk of breast cancer recurrence or breast cancer coming back compared to those who fasted overnight for 13 hours or more. They also found that nightly fasting for less than 13 hours was associated with a higher risk of breast cancer mortality or the risk of breast cancer death related to breast cancer. So the fasting period equal to or greater to 13 hours, they also found that hemoglobin A1C was significantly lower in those who fasted for longer periods of time. And then also that sleep duration was improved for those who fasted for longer periods of time. And so the conclusion was by the investigators, is that intermittent fasting basically can potentially be a drug-free prescription when it comes to reducing the risk of recurrence or reducing breast cancer, preventing breast cancer, and also reducing the risk of breast cancer mortality or breast cancer death. And so the thought or the physiological kind of connection is that it's probably related to glucose regulation, which is connected to insulin, right? So when glucose is well regulated, insulin is well regulated, and insulin actually potentially acts as a growth factor when it comes to hormonal cancers like breast cancer. So wanted to point that out to you too as a preventative idea. Okay, so the next category is going to be hormonal regulation. So the first hormone that I want to highlight is cortisol. So cortisol is a hormone that's secreted from our adrenal glands, which sit right above our kidneys. And cortisol is a hormone that we need. You know, we need cortisol to function, and it's supposed to be, has a particular rhythm to it. It's supposed to, when we wake, it's supposed to begin to elevate because we're ready to move and kind of get our day started. And then it's supposed to taper off in the evenings as we're preparing to rest and to sleep. However, when stress levels are elevated, chronically elevated, that is what causes cortisol levels to become elevated and stay elevated. Now that chronic elevation leads to trouble for many different reasons, including cancer. So the point here is that stress management is very important when it comes to cancer prevention. So in terms of the physiological impact when it comes to chronically elevated cortisol levels, it's connected to, or it can lead to, an increase in blood glucose levels. So I mentioned that insulin can act as a growth factor when it comes to hormonal cancers like prostate cancer and breast cancer, ovarian cancer, and others. And so if that blood glucose levels elevated, we're promoting potentially, what we're certainly having an impact on that soil or that terrain. Increased cortisol levels can lead to immune depression, can certainly have a negative impact on immune function. Now, at night when we're asleep, there's an important hormone that we're going to talk about called melatonin. Now, when cortisol levels are elevated, it actually inhibits the secretion of melatonin, and melatonin is something that is important that we need. And so we're going to talk about the importance of melatonin in a second. Elevated cortisol levels also increases the activity of the aromatase enzyme. Now, the aromatase enzyme, when that is elevated or kind of chronically activated, that can increase our risk of hormonal conditions like breast cancer and hyperestrogenic kind of conditions and other things. So keeping that enzyme system well controlled is important for prevention as well. Now, so what can we do about stress? So in the naturopathic world, or even in the integrative care world, I love to use adaptogens, and a lot of my colleagues do as well. Now, adaptogens are herbs that support our body's ability to accommodate physical stressors and mental stressors. So whether we're having elevated stress levels due to pain or sickness or an injury, or if it's because we're worrisome about something that's happening, the same kind of physiological reaction happens inside. And so we want to address whether it's a physical or a mental stressor, we want to address it the same way. Now, the beauty of the adaptogens is that it helps to reduce elevated cortisol levels. It helps to modulate that hormonal kind of communication that happens within the HPA axis. There's actually studies showing that herbs like, oops, wait a minute. Oh, I'm so sorry. There's a slide that's missing. I'll just say it out loud. Sorry about that. But the next slide was supposed to be the adaptogens that I'm going to talk about now. But the two that I like to use most, number one is ashwagandha. Ashwagandha is probably, I'm sure most of you have heard of it. It's the most popular used adaptogenic herb, and also very well studied. There's certainly studies showing that that ashwagandha helps to reduce cortisol levels and helps to reduce quality of life as it relates to anxiety and stress and kind of mental wellness. The other adaptogenic herb that I was going to highlight is called rhodiola. So rhodiola, also very well studied, also considered an adaptogenic herb, can also help to reduce cortisol levels as well. Now, the ashwagandha is more appropriate when stress levels are high, connected with anxiety. Rhodiola more so when stress levels are high and there's a connection with depression or kind of mental and physical fatigue, but each certainly important when it comes to stress management and regulation of that hormone, cortisol. Okay, the next herb that I wanted to highlight as it relates to stress management is lemon balm. So lemon balm is not an adaptogenic herb. It's actually referred to as a nervine. It's in that category. And so this one is often used when it comes to anxiety and insomnia and stress management, because anxiety and insomnia often result from elevated stress levels. And so this one has been studied as well. This is a small study that I wanted to quickly review with you. So under acutely stressful circumstances, lemon balm has been shown to improve cognitive performance and mood, but also to reduce stress and to help to reduce anxiety. This herb, as I mentioned, can also help when it comes to sleep hygiene. So helping with sleep latency or falling asleep, and then helping with staying asleep, especially when it's combined with valerian, which is another herb that is considered a sedative herb. Okay, and some other things that we can do outside of herbals or oral kind of things that help to regulate and reduce cortisol levels is to participate in activities that bring us joy, or that reduce our stress levels. So whether that be laughing with a friend or watching a funny movie, laughter is certainly therapeutic. Exercise, very important when it comes to upregulating those feel-good hormones and neurotransmitters. Meditation, prayer, deep breathing, and then spending time with family and friends, whether that be within your household or on phone calls nowadays or on Zoom calls, but really making those connections and creating that protected time so that you are able to participate in stress reducing activities on a regular basis is definitely a prescription when it comes to cancer prevention. Okay, the next hormone that I'm going to review is melatonin. So mentioned melatonin briefly a few slides back. Now, melatonin is a hormone that is naturally secreted from our brains, from the pineal glands of our brains specifically. And in order for this hormone to be released, we must be sleeping in a dark, quiet room. So melatonin is actually inhibited by light, stimulated by darkness, and it helps to balance our sleep-wake cycles, also referred to as the circadian, circadian rhythm. So optimally, we should be sleeping for 7 to 8 hours in a dark room without light or computers or electronics. Again, these things disturb the release of melatonin. Now, melatonin is important for many different reasons. It helps to support immune function. It helps to inhibit cancer development and growth. Melatonin also acts as an important antioxidant. So similar to some of the things that we talked about, like turmeric and the berry family, the anthocyanins, that antioxidant is important when it comes to protecting the DNA within the cell from any kind of damage. Melatonin also triggers tumor suppressor genes. So these are genes that help to, as the name sounds or suggests, helps to prevent or suppress the growth or proliferation of cancer cells. Also helps to suppress tumor angiogenesis. Melatonin also suppresses the synthesis and secretion of sex hormones like estrogen. So when melatonin is high, those sex hormones are kind of inhibited. And so, when estrogens are elevated, that can potentially, especially if they're elevated for prolonged periods of time, that could certainly have an impact on those more hormonal kind of cancers. Now, so melatonin obviously related to sleep. And so there's studies in recent years showing that there is definitely a relationship between lack of sleep and increased risk for many different cancer types, including prostate, including breast, and including colorectal. Also studies showing that women who routinely sleep fewer hours may develop more aggressive breast cancers compared with women who sleep for longer hours. And it is proposed that melatonin has a lot to do with that in terms of helping to prevent this from happening during those sleeping hours, but there are probably other factors that come into play, but melatonin is definitely a big player in that. So this was a study I just wanted to quickly review. It's probably, it's done in 2008, so a little bit ago, but over 23,000 Japanese women, and they looked at sleep duration. What was the connection between, or was there an association between sleep duration and increased risk of breast cancer? And they found that those women who slept for 6 hours or less had a significantly increased risk of developing breast cancer compared to those who slept for 7 hours each night. And what was interesting about that study is that they found that those who slept for 9 hours or more, there wasn't a benefit with that. They kind of fell into that 6 hour kind of category. So in this case, it's not the more sleep, the better. That balance is important in terms of that 7 to 8 hour kind of period of time for sleep. That's the sweet spot. Okay, the last hormone that I'm going to review as it relates to cancer prevention is insulin. So I mentioned a couple times already that insulin can act as a growth factor when it comes to many cancer types. So up to 80% of all human cancers are driven by the effects of glucose, which stimulates the release of insulin. And again, insulin certainly acts as a growth factor. It can tag on to cancer cell receptors and stimulate the proliferation of those cancer cells to expand. Chronically elevated levels of glucose and insulin, again, stimulate cancer cell growth, inhibit cancer cell death, this process referred to as apoptosis. Increased insulin levels can lead to metastatic spread. And also, we talked about increased inflammation levels, but also increased insulin levels can cause a resistance to cancer cells even being receptive to therapies like chemotherapy and radiation. And then also taking in a lot of sugar, which leads to increased insulin levels, can also have a negative impact when it comes to immune function. So what do we do to regulate our insulin levels? We have to look at diet, obviously, right? We have to be very cautious about the food that we take in. So adding fiber to our meals to help to prevent sugar spikes. So lots of vegetables, moderate amounts of fruit, things like flaxseed, things like chia seeds. And we want to choose foods that are lower in sugar content, right? With a lower glycemic index. A Mediterranean-like diet has been proven to certainly be beneficial when it comes to sugar and insulin regulation, as well as breast cancer prevention. Mediterranean diet is very important for that as well. Exercise decreases insulin sensitivity, so exercise can be therapeutic as well in terms of when it comes to regulating sugar and insulin, and for so many other reasons, right, that we know about. And then green tea also helps to improve that insulin sensitivity, so that EGCG in the green tea is going to be important for that too. Okay, so the next thing that I want to, next factor I want to review is support of liver detoxification. So in our comings and goings, we take in xenobiotics, also referred to as just kind of carcinogens or foreign chemicals, through the foods that we eat, personal care products that we use in our bodies, air that we breathe, cleaning items, etc. It's coming at, these chemicals are coming at us from different angles. And so with that being said, we can't eliminate those things. Well, we can reduce the intake of those things, or we can reduce the exposure of those things, but we can't eliminate all of them. But we can certainly support liver function when it comes to detoxification. So the liver is our major detoxifying organ, and so we have to treat it well. And so we have a phase 1 detoxification process and a phase 2 detoxification process. These are the main detox pathways. And so when it comes to phase 1, it takes that fat-soluble carcinogen, turns it into a intermediate, and then phase 2 is kind of like a tag team, takes over, adds a protein to that, and then it's eliminated out of the body. Now, phase 1 and phase 2, they work together. And so it's important that we are supporting each of those phases with food and with supplementation when necessary. So detox phases help to minimize cell damage from environmental toxins. So if you look at this picture here, you'll see the picture of phase 1 and phase 2. They're different. There's specific processes that happen within each of these phases. And then you'll see underneath that there are specific nutrients that are necessary to support these phases. And so this is where diet comes into play. And like I said, sometimes supplementation. So B vitamins are going to be important for each of those phases. So making sure that we're getting our leafy greens and our nuts and seeds. Vitamin C is going to be important. Glutathione is going to be important. That's our kind of master antioxidant. So making sure that we're taking in clean proteins and selenium-rich foods like Brazil nuts, and really just making sure that we're maintaining a whole foods, rainbow, varied diet so that we're able to obtain the nutrients that our bodies need, or that our liver needs to perform phase 1 and phase 2. Now, there are certainly detoxification protocols, former protocols that you can follow, and some of you may have done that before. I certainly do that with some of my patients when it comes to cancer prevention, and even between chemotherapy treatments, because most of those chemotherapy drugs are metabolized through the liver, so that's very important, but also important when it comes to disease prevention or cancer prevention. And so in terms of some key kind of foods, that I guess I probably mentioned a couple of these already, but the cruciferous family of vegetables, the sulforaphane that I mentioned, that important constituent that is especially important when it comes to liver cleansing and liver detoxification. Limonene, so oranges and tangerines, your whole grains. Nutritional yeast is a good source of B vitamins, and certainly your leafy green vegetables, as I mentioned. Vitamin C rich foods. Again, curcumin or turmeric is a hepatosupportive, so that's going to be important when it comes to liver detoxification. Artichoke is great, and then dandelion greens are very good when it comes to liver detoxification as well. Okay. Now, just wrapping up, because I know we're coming close to 1 o'clock here. So when it comes to supplementation, this is just a general list. And of course, supplementation is very individualized, whether we're talking about cancer prevention or active cancer diagnosis. But these are just some general recommendations that, that are made when it comes to prevention. So vitamin D3. So vitamin D is something that most of us need, very important to have your lab levels checked on a regular basis to make sure that you're being dosed appropriately. Some of us may need 2,000 a day. Some of us may need 10,000 a day. It just depends on what your laboratory results reveal. So D3 is important when it comes to improve survival with certain cancer types like breast and prostate, lung and pancreatic cancer. Vitamin D is also associated with a reduced risk of certain cancer types like breast cancer and colon cancer and prostate cancer, and so many other benefits when it comes to vitamin D as well. Important when it comes to immune support, important when it comes to cardiovascular support, prevention of autoimmune conditions, but certainly indicated when it comes to cancer prevention as well. Omega-3 fatty acids in supplement form is something that I often recommend just because that fatty acid is an important healthy fat that is deficient in our diet, and it is essential, which means that we need it, but we're not able to make it within our bodies. So we need to take it in with food or either with supplementation. So omega-3 fatty acids are natural anti-inflammatories. Vitamin D is anti-inflammatory as well, but fish oil, definitely an anti-inflammatory, helps to modulate immune function, which is going to be important too. And it has been associated with a reduced risk of a number of different cancer types. Now, I've also listed a good quality multiple vitamin here, and that really depends on the person. So for example, if there's a micronutrient test that's done and there are a number of vitamins or antioxidants that have been shown to be deficient, that would be a good time to use a good quality multiple vitamin. Another thing that I think about is when it comes to detoxification, we saw the list of the number of vitamins and minerals that are required to support healthy phase 1 and phase 2. Would certainly be indicated under those kind of circumstances. So anyway, those are just some general recommendations. There are lots of other things and supplements to do for cancer prevention, but these are just kind of the, I guess the foundational supplements. You can think of it that way. Okay, lastly, what I wanted to mention is our laboratory studies. So when it comes to cancer prevention, it's important to have just like in general health, it's important to have laboratory studies done on a regular basis. So looking at things like CBC and with the differential, which looks at not only your white count and your red count and your platelets, but also looks at the different types of white cells. So for example, when you're looking at the different types of white cells, like neutrophils and lymphocytes, for example, if the ratio is off or imbalanced, that could indicate inflammation. So that's something important to pay attention to that your provider can certainly help you with. Metabolic panel is very helpful too when it comes to looking at glucose, right? We know blood sugar regulation is very important when it comes to cancer prevention, but also looking at liver function, kidney function. Vitamin D, we mentioned the importance of that. Looking at hemoglobin A1C and insulin as it relates to blood sugar regulation. And then I also listed a C-reactive protein here. C-reactive protein is a general inflammatory marker, and it can be associated with a number of different conditions, but when that number, or if that number starts to rise, it's definitely something to pay attention to. So not that these labs are diagnostic, they're not diagnostic of a cancer diagnosis, but they can certainly act as a kind of an alert or guide if a deeper dive is necessary. Okay, so that concludes my presentation for today. Again, thank you for attending. I'm happy to take any questions that you have. Let me see. I'm going to try to access the questions here. I guess I have to stop my share.
Dr. Keats, thank you so much. We have a little more time. We usually
run
over just a little bit. People
okay.
have to go at once. Some people have to go. A lot of people stay on. But this great presentation and a lot of great tips here from nutrients to how to reduce inflammation and some things at the end on supplementation. Yeah. So Laura has a question. It looks like you can see the panelists.
Now I've got it. Okay. Yeah. Let me pull it up. Let me see.
Laura says melatonin helps me sleep.
Yeah.
And for 2 to 3 days, and then it kind of keeps her awake after that.
Oh, and Miss Ahmad, it's great to see you here. Thank you. So the melatonin. Yeah, so melatonin, so there's two main ways to use melatonin therapeutically. One is if you're taking a low dose of it, and I'm assuming that you are, so low dose meaning 1 to 5 milligrams can be helpful when it comes to sleep regulation, but then higher doses are like 10 grams and above or more, milligrams and above are more indicated for cancer fighting support. Now, if melatonin is doing that for you, you may be making enough of it. You may need to switch to something else when it comes to kind of supporting sleep cycles. So it may just be a point of switching to something different. You may have adequate levels in terms of the amount that you're secreting. So it may be that you need a different kind of a form of support to support your sleep cycles. And there's actually a lot that you can do to help with sleep outside of melatonin.
Liz has a question here. Let's try to see if she can. Liz, are you there? Jen, do we have to do anything?
Hear me?
Hey, yes.
Okay,
Hey,
2 questions.
Yes.
One, is coconut oil considered a good fat? That's 1, 2, and what would you say is a good level for the vitamin D3?
Good blood level for vitamin D3, I like to see it as high as 80. So yeah, I would say between 70 and 80 is where I like to see it on the labs.
Dr. Keats, what about for cancer prevention? Is there a certain level that's either an expert opinion or research on D3 levels for cancer prevention? And also if someone has secondary cancer prevention.
Yeah,
too.
I would say around the same level between 70 and 80 is where I like to see it, definitely.
Okay, so you really want to get those T regulatory cells working and
yeah,
kind of keep that inflammation level down. Yeah,
absolutely, okay. Absolutely. And then, having your levels checked, regularly to make sure that you're on point, absolutely.
Yeah, right.
And yeah, coconut oil is a healthy fat to take in. Extra virgin coconut oil. The thing with coconut oil is that you have to be careful with the amount of heat that you expose it to. So up to medium kind of level heat, but not for high heat cooking. But definitely something that I recommend in the healthy fat category.
Fantastic for both. Thank you.
Sure. Okay, let's see. So someone asks, what are good foods for leukemia? So that depends. So for one, leukemia impacts white blood cells. And so it depends on where your white cells are. So I would say when white cells are low, whether it's a leukemia or a different cancer diagnosis, you have to be careful about your raw food intake. If those cells are within normal range, then there's not a specific diet for leukemia. I would say to stick with the general things that we talked about, like the anti-inflammatory, whole foods, rainbow kind of array of foods, but there's not necessarily a specific diet for leukemia unless some of those cells are impacted. Now, the thing I will say about leukemia, though, not when it comes to food, but more so when it comes to supplementation, is that makes it distinct, is that you do have to be cautious about around immune stimulation, just because it does involve white blood cells. So strong immune stimulant kind of supplementation should be used with caution, but when it comes to food, it would just be those general kind of recommendations that we talked about.
Immune stimulants versus immune balancers, is that what you're saying? So things like
Right.
ECDC would be okay, but not echinacea? Is that what you're thinking?
Thank you for asking that. Yes, so that is true. So immune modulation, so things like probiotics or fish oils or green tea, that would be fine.
Would be safe, okay.
But of course, you'd have to be concerned about drug and herb interaction. But in terms of leukemia itself, yes. But yeah, the stimulation like certain mushrooms and like echinacea, for example, would be contraindicated.
Okay, great. That's great. Thank you, Mustafa, for that question. Laura also asked, is broken up sleep for 4 hours up to 30 minutes for an hour, so I think waking up in the middle of the night and then getting another 4 to 5 hours, is that still a good night's sleep? That's a really good question.
It should really be ideally 7 to 8 hours of consistent sleep undisturbed. That is definitely the ideal kind of situation. So I would recommend that you speak with your healthcare provider about things to help with to help you stay asleep.
And people get up in the middle of the night to go to the bathroom or, other things.
Yeah,
if you're able to go back to sleep quickly, that's okay.
Yeah. I mean, in those kind of situations, I do generally recommend that patients have their beverage earlier in the evening, so that doesn't even happen. But it's definitely better to have those brief kind of, disturbances like bathroom breaks and going right back versus being up for longer periods of time.
Yeah.
But there's a lot that you can do when it comes to helping to stay asleep. So definitely something that you should speak with your provider about.
Yeah, definitely. When you're sleeping, your detox system is more active, and when you're not sleeping, it's sort of stops working as actively. So probably that's affecting that detox pathway.
Yeah, and so many other processes. Yeah, absolutely.
Great. So Rashida, I think you can read the question there. I don't know if you can see it, right? But Rashida asked there.
Okay.
Rashida says, Rashida was diagnosed with breast cancer around 10 years. Through the years, she has not had consistent labs and blood pressure, slightly elevated cholesterol. Any suggestions? I think the first thing would be, do you see a practitioner? I mean, that would be, to get the lab work for sure.
Yeah, I mean, that's the foundation, because you would need that information in terms of providing guidance on a specific treatment plan or approach. So I would definitely say that would be the first step.
Yeah, you're welcome to come over here to CIH, and we can see you here. It's, online or virtually, now or in person potentially. Great, thank you for the question, Rashida. And TJ asked about. Can we go back to Rashida's for a second? So with the blood pressure slightly elevated and cholesterol, would that be more of a nutritional intervention or lifestyle? How would you treat blood pressure and cholesterol from a naturopathic medicine perspective?
Well, it depends on how high they were elevated. So like I said before, diet is always the foundation. So I would definitely say diet would be the first layer. Supplementation would be the second layer. If the level is of blood pressure, cholesterol is kind of alarmingly elevated, then I would definitely refer out to conventional care for an integrative plan.
Now, there are receptors in the blood vessel that raise blood sugar, blood cholesterol, and blood pressure simultaneously. So a lot of times we'll see people with a double or triple diagnosis, but it's really the same foundational root cause, which is inflammation of the blood vessel. That's stimulating these receptors that are causing blood pressure and cholesterol. So it's really, like you said, Dr. Keats, more of a lifestyle, type of thing to get that inflammation down. Great. TJ was asking. Thank you for the question, Rashida. TJ is asking, this is a great question. I'd love to hear your answer to this. How much does cancer history increase the risk of COVID?
Um, I haven't seen any in the literature any direct relationships between cancer history and the risk of COVID, but I would I would say that if you've had a cancer diagnosis and if you've been treated for cancer, there is a risk of immunosuppression, which would make you potentially more at risk for COVID. So I would say that would be the only kind of connection that I would make, but I haven't seen anything in the literature making a distinct connection between the
I mean, if
two.
someone has active chemo treatment or the white
Oh,
blood cells are
absolutely.
low, then that
Yeah,
would be, that would certainly be an increased risk
yeah,
there.
definitely.
Yeah, great. Good, good question. Thank you so much. I think we are concluding today. Thank you so much, Dr. Keats, for coming on. This is a wonderful talk, and I know a lot of people learned a lot about cancer prevention. And Dr. Keats's website here is drkeats.com, and she's part of CIH virtually here online, and you can go to her Facebook site here and talk more with her there. So thank you, Dr. Keats, and be in touch very soon.
Yeah, thank you.
Thank you. All right, everyone, have a great week, rest of your week, and enjoy your weekend, and we'll see you here next week.